What is social prescribing?
My name is James Moore. I'm an ABCD community builder and I'm a social prescribing link worker. So social prescribing has different models and it came into primary care so as to help people who are presenting to the GP surgery with different needs than that of a biomedical consultation, which is why you would go to a GP. However, people will come to the GP now for various reasons. And now social prescribing is a way of addressing those social determinants of health.
I think social prescribing, to me, it means really giving the opportunity to patients or people that we find falling in between the cracks, patients who need social support, who end up at the GP practices because they've got nowhere to go.
How does it work in Croydon?
In Croydon, we have the social prescribing model, which puts a community builder or a community champion in the place of a link worker. So a link worker will talk to a patient, find out a little bit about what's going on in their life, and find out what they'd like to do in their life. Hopefully find out what things they'd like to address to make them feel healthier, to make them feel happier, and maybe connect them more closely with their community.
So a link worker for me is like a bridge in that respect. And we thought, you know what, we'll go ahead and we'll sort of see how we can make this work together. I'm all for, collaborative working in partnership. At the end of the day, if we're all joining forces, then yes, we are going to do what's better for the community at large.
The Croydon model highlights the significance of partnership between the VCS sector and link workers. By building relationships within the community, link workers are able to connect individuals to the right organisations.
Well, what I've found works for me is that I had those relationships put in place in the community with different organisations, local people, for example. So I think if you're going to enter social prescribing or employ a social prescriber, they've got to have that. They've got to have that experience working with the community, working with voluntary sector organisations to make sure that they can get the best out of social prescribing, as that's what it's encouraged to do as well.
Case study, Sean's story.
So when I first came across Sean, I was referring him lots of different assets, if you like. It wasn't until we started to develop that relationship with the local community asset of Heads Together, it started to become more social and less prescribing, which I think has really had an impact on not only Sean, but Heads Together, and also the understanding of how we can develop this role.
I've been receiving help from a number of community groups, namely Croydon Voluntary Action, Heads Together, and Centre for Change, and they've all been really helpful in my life at the moment. When we broke it down and you became more of the resource, and there was more of a personable element, it really did help for me, and hopefully that will be that kind of approach will work for others as well.
The next steps for social prescribing.
We should be able to work in partnership. We have to understand their referral criteria. We have to understand how they are supporting the people that we are referring them to, and be able to get feedback and update as well.
Patients are complex, and unless you have an idea about how complex they are and how you can deal with most problems, and that at the basic level, you cannot give the appropriate care. So I would increase the training for social prescribers an awful lot.
I think that I'd like to see a focus on building relationships in the future around social prescribing, and perhaps talk about those people as link workers and focus on that role in the community.